Hi, everybody. Today our presentation will be on functional communication training, and it is going to be used at Ellison Preschool, and this will be presented by Nicole Christie, Tori Curiel, Jasmine Williams, James Downs, and Emily Frommel.
Before we get into what functional communication training is, I wanted to give you a little bit of information on setting and population. So this is Ellison Preschool. It is located in an urban area. The school services 200 students between the ages of 3 and 5 years old. 150 of these students receive special education services. Ellison has 20 classrooms with 8 to 12 students in each room. There are 2 classroom assistants and 1 classroom teacher in each of the classrooms. There are related service staff members who also work with the students at Ellison Preschool. These include 1 occupational therapist, 1 physical therapist, 1 board-certified behavior analyst, and 2 speech and language pathologists. 50 of the students that receive this service of speech and language, there are 25 students who are nonverbal, and 20 of the students occasionally point or grunt to different objects or items that they want or need. 5 of the students use the Picture Exchange Communication System, or PECS. Why is there a need at Ellison Preschool for a change? There are problem behaviors during playtime, and this includes fights over toys between multiple students or tantrums by individual students. The problem behavior occurs most when the student takes a toy away from another child, or the students who are taking the toys do not ask for the object or are asked to play with the other student. So what is an intervention that best addresses these problem behaviors demonstrated by the students at Ellison Preschool? As a team, we decided that functional communication training would be best. So what is functional communication training? According to Tiger and his colleagues in 2008, functional communication training is defined as differential reinforcement procedure in which an individual is taught an alternative response that results in the same class of reinforcement identified as maintaining problem behaviors. Here is a visual of how functional communication training will be used to help these children. So if a child wants a toy and they verbally request the toy, then the child will get that toy. If a child wants a toy and uses a PECS card, then the child will receive the toy. If a child wants the toy and the child grabs the toy or has a tantrum or begins a fight, then the child will not receive that toy. So who is functional communication training most appropriate for? James is going to talk about this slide.
All right, so functional communication training is appropriate for all school-age individuals. FCT may be used for students who are delayed in areas of verbal communication as corresponding to their developmental age, and as a result have displayed either aggressive, destructive, or tantrum behaviors.
So what tier is FCT appropriate for? Functional communication training is appropriate for students in Tier 3 according to the Positive Behavior Intervention Support System. This intervention will be individualized for each student participating. Therefore, it is selected for students with severe problem behaviors. As this intervention becomes effective for the Tier 3 students, it could also be used for Tier 2 students by teaching vocally appropriate responses rather than using PECS. This intervention could even be modified to reach Tier 1 students. However, the structure of the intervention would be less intensive.
So how will functional communication training be used at Ellison? So the problem behaviors that we have seen in the classrooms at Ellison include tantruming and fighting between 2 or more students over a toy during playtime. The students will choose a list of items that can be used as a reinforcer, and then these will become the motivating operations for the children to use appropriate communication. The replacement behaviors that will be taught is based on the student's individual needs. So the students who demonstrate verbal communication will be taught to ask for the toy by saying, "Can I have the toy?" Students who demonstrate pointing or grunting behaviors or who do not verbalize will be taught to use the PECS system to indicate the specific toy that they want. Students will be reinforced for demonstrating the appropriate replacement behaviors, and data will be collected on the student performance. How will functional communication training help at Ellison? So by teaching the students to use the appropriate behaviors, they will demonstrate appropriate and safe behaviors during the playtime, and this will help to decrease the fights between 2 or more students and the tantrums within the classroom. Who will be implementing functional communication training at Ellison? All of the staff members at Ellison Preschool will be a part of the implementation process within each classroom. I said earlier, there are different staff members, including 1 principal, 20 teachers, 40 classroom assistants, 1 occupational therapist, 1 physical therapist, 2 speech and language pathologists, and 1 board-certified behavior analyst. The teachers will be responsible for teaching the students, and the classroom assistants will collect the data. The related service staff members will follow through with the implementation plan as well when they are in the classroom with the children. The leadership team in the school, the principal, the occupational therapist, the physical therapist, 1 speech and language pathologist, 5 classroom teachers, 2 classroom assistants, and 1 BCBA have all been chosen to be a part of the leadership team to help make sure that the functional communication training is implemented with fidelity throughout the school. Jasmine's going to give a brief intro to this video.
Yeah, so here are, there are going to be 2 videos, FCT Part 1 and Part 2. It just gives a little role play into how FCT should be implemented with children.
Good job. You got the first piece in. That was interesting. Sign for 4 pieces. For you. Where does it go? Where does it go? Do you need help? Say help. Help, please.
So that was part 1, and then here is part 2.
Joe's getting frustrated and didn't want to do this activity anymore.
And then we had a 3rd video that Emily will briefly introduce you to.
So the first 2 videos showed the kids, I'm sorry, not the kids, the therapist working with the student and teaching her how to sign using functional communication training. In this last example, you see 2 children working together, which is what we're wanting to do at our preschool with the kids, giving them an opportunity to take turns and use functional communication training to work together and play together appropriately.
It is. We can paint some more. Is your turn over? Is it Bradley's turn? All right, what do you need? It's Bradley.
So as you could see in that last example, the kids, the one kid gave the other kid a PEX card telling him that it was now his turn, and then he gave him the paintbrush, so they were able to take turns painting. So now we're going to talk about how we will plan for implementation. The plan for implementation is to identify 2 students in each classroom that could benefit from functional communication training. Materials for indirect and direct FBAs, functional behavior assessments, will be prepared for each student included in the study. The PEX picture cards will be created using pictures of items that will be necessary to teach the FCT skills based on the data collected from the FBAs. The staff members of Ellison Preschool will be trained on how to conduct the FBAs, how to prepare the materials, and how to teach appropriate replacement behaviors using FCT.
Okay, so Current practices that are facilitators or barriers for implementation. So there are two major barriers for implementation of functional communication at Ellison. So the first is lack of training volunteers. So the volunteers in each classroom are actually parent volunteers. So the volunteers are only there and they're not assisting during the playtime in which the problem behavior occurs. So most of their volunteer role is providing copies for the teacher, and doing paperwork. The second is trained professional ratio to students. So as Nicole previously mentioned, there is a limited amount of trained professionals in the school. So there's not enough trained professionals in the school to provide sufficient support to the teachers to best be able to implement functional communication training. As she mentioned, there's only 2 speech therapists, an occupational therapist, physical therapist, and 1 BCBA.
So now I'm going to go ahead and go over the steps for implementing functional communication training. So the first step would be to identify the interfering behavior or the target behavior. Examples of this would be hitting, falling to the floor, crying. The second step would be to complete an FBA, which is a functional behavior assessment. This will include indirect assessments such as rating scales and interviews, and then some direct assessments such as observations and collecting ABC data. After this, we'll do step 3, which is identify the replacement behavior. This behavior would substitute the target behavior. The replacement behavior will still allow the child to get what he or she wants just as easily or more easily than the problem behavior. The fourth step is to design and implement data collection procedures. This is completed during the FBA and FCT. It focuses on antecedents, prompts, frequency of replacement behavior, and interfering behavior, and the consequences of the behavior. Step 5 is to manipulate the environment. We want to create opportunities to practice the replacement behavior, so we might manipulate the environment in order to get the students to engage in the problem behavior. The 6th step is to plan for generalization. So we need to practice this across multiple staff members, environments, and use varied vocabulary when teaching. The 7th step is to prompt learners to use the replacement behavior. We would use most to least prompting so that the students are guaranteed to be successful. The 8th step is to avoid reinforcing the interfering behavior. The 9th step is to provide reinforcement. The 10th step is to shape the response. So we want to initially accept and reinforce approximations of the replacement behavior and then require closer approximations if needed. 11th step is to fade the prompts. So use a time delay to fade those prompts. The 12th step is to increase the time between the replacement behavior and reinforcement. And then the last step is to monitor the learner's progress. We want to review the data and then make changes as needed.
Okay, so here are a description of a lot of the materials used in the FCT and also out of the FCT when you're trying to implement it in a natural setting or in the classroom and things like that. So a functional behavior analysis is basically the bread and butter of having a successful FCT. This is an assessment that has the goal of determining the function of the target behavior and helps create an intervention for the behavior. Once you know what the function is, it will be easier to find a appropriate replacement behavior for that negative behavior that we're trying to target. Like Nicole said and Emily, there will be a token system utilized for all of the students, regardless of nonverbal or verbal, just to be a tracker for their reinforcement. And it also gives positive reinforcement when they do the task and behaviors that we place on them. Reinforcers is also important, and it can range from edibles, which is like goldfish and candy and things like that, all the way from, going to play outside or reading a book. And it's really important to have reinforcers because those will motivate the child to have appropriate behaviors instead of interfering behaviors. Data sheets, Tori will talk about that in a little bit. It's basically a sheet used to take ABC data and also record if the replacement behavior was implemented correctly. A clicker is a device used to take frequency on a behavior. This will be used for how many times the child will engage in that interfering behavior. And we also have a timer that we will use if the behavior is long and we need to take the duration of it as well. A choice board is a graphic organizer that lets individuals choose what they want to work for and what they want to do, and also how they might complete their tasks. So it comes in about 9 blocks, and it says, I want to choose, and they'll take it off and they'll put it on there, and that will be their choice board. They will carry that around, throughout class and things like that as well. Communication devices, we are using PECs, and some of our nonverbal students will be using Proloquo as well, which is a really popular communication device. The PECs, it's mainly targeting, for nonverbal individuals, and Proloquo is a communication device that you can get on an iPad or tablet, and it helps promote language development and grow communication skills, which is what we're trying to do with FCT. So here are some of the samples of the materials. Like I said, reinforcers can range, but these are most of the common that you will see in the Ellison Preschool classroom. The token board is on the left, iPads, PECs, what Proloquo will look like. So the teachers will know how to implement everything, and just the clicker and timer, how to measure the frequency and duration of the behaviors.
Okay, so as you can see, here's our data collection sheet. So data should be collected throughout the entire observation. And then here is a sample data collection sheet. So on the sheet, the classroom assistant will be putting down what the student's name is, the date, who was observing the behavior, and then you'll be marking down what activity was occurring, the antecedent, so what was happening before, and then whether or not the child used the replacement behavior, which would be the functional communication. And then if they needed a prompt, what kind of prompt the observer implemented, and the consequence to the behavior, which would be whether if they engaged in a tantrum or aggressive behavior, then they wouldn't get access to what they were wanting, or if they use the functional communication, they wouldn't get access to the preferred item.
So the capacity for implementation at Ellison Preschool has the capacity to implement FCT in the classrooms. They have plenty of staff members in each classroom that can be utilized for training and data collection. And then there are also 4 to 6 additional volunteers that could be utilized to implement this intervention with the proper training. So they do have the resources required to do this. And they have the resources to create the necessary materials and the computer programming to graph the data. They also have the necessary data collection materials.
So having a positive and supportive community is very important for Ellison Preschool. So what will happen is we will send home flyers about FCT, Proloquo, and also LAMP, which is another communication device. They'll be able to take their device home, and also the flyers, what they will do, they will be bi-weekly flyers every month. And that will just, explain, what we're doing at school, what we're implementing, and how it is affecting their child in a positive way to raise their communication levels. The way that FCT techniques will be implemented at home is that parents will not feed into the function of the behavior. So say it's for attention, they will withhold attention if they are engaging in that interfering behavior. They can redirect to their communication device, which will be either PECs or Proloquo, and it will also supply reinforcement when using the communication device instead of the negative behavior, which is great because they're in a naturally setting, they're at home, and we want to make sure that that replacement behavior is following into the home. Final tips for implementation. Choose a short and simple replacement behavior that can be learned quickly. Multiple environments, like I said before, having it at home and in the school is also important. We want to make sure that the kids can generalize that the replacement behavior is needed, everywhere, that it's appropriate, to not go into that interfering behavior. Multiple individuals will be implementing the FCT. So like I said, parents, the therapists, the teachers, they will all be learning this. So they will be able to implement it correctly. The ABC data collection accuracy is also important because that will give us the antecedent of why they're interfering in that behavior and also the consequence, so we can have an appropriate replacement behavior for them to engage in. My motto is successful FBA equals successful FCT. If you have a successful FBA, they will have a good FCT due to the fact that you will understand what the function is of the behavior to create a replacement behavior for that child. And it ranges case by case. So you really just have to look at what function that behavior is engaging in, and you'll be able to figure that out. Also, we'll make sure that each kid has a form of communication, regardless of if it's PEGS, Protocol, or LAMP. And the verbal kids, if they have maybe pronunciation issues, we can always go to our speech therapist with that, and they will be able to get therapy with a speech therapist as well in school.
And then these are just some of the references that we have used throughout this presentation, as well as throughout our ABA guideline. And
thank you so much for listening to our presentation today. I hope this helps train the staff at Ellison Preschool to use functional communication training.